name is Nwali. I'm from Zambia. I found Apollo Hospital over the internet after needing to do a cardiology procedure.
This gentleman, Mr. Daniel, he came to us from far-off country, Zambia. That's a country in Africa. Previously, we got the report from him through email, which is suggesting that the patient has some coronary blockages and he has got a procedure done in Zambia also. But still having pain on minimal exertion, like for walking for 100 meters or so, he feels chest pain and he has to sit down.
We contacted the hospital and immediately we were given very positive feedback. We were helped a lot from the time we made the inquiry with regards to the procedure that needed to be done right up until the time when I arrived here in India.
So he came to us. On the initial evaluation, we done the routine test followed by an angiography. The angiography is suggestive of there is a left main blockage along with a blockage in all the three vessels of the heart. And those three vessels blockages are very critical. So instead of going for a stent procedure, we opted for a bypass surgery, as that is a better procedure for the patient and for the long-term recovery of the patient. Patient was operated second day after the angiography with a total arterial graft take. Means we put the total arterial graft, there is no graft which is taken from the leg vein.
I will be leaving to go home tomorrow and absolutely feeling like a totally different person, and I would just like to say thank you very much for this, and I would not hesitate to send anybody here to your facility. I have been very impressed, and I take this opportunity to say thank you.
Patient recovery was uneventful and he was discharged 7 days after the bypass surgery. After almost 8 days after the discharge, we again called the patient for a follow-up visit. We removed the stitches. Now the patient is doing perfectly fine and he is very happy with the procedures. Further, he will require some medication for 1 year, and after 1 year his medicines will be tapered off.
My experience has been very pleasant. I have been assisted a great deal by members of the hospital within the administration and other sectors of the hospital. I have found the hospital to be extremely professional. The service I have received, I cannot complain about it. It has been second to none. You can imagine coming from a foreign country for such a procedure, it can be a little bit concerning, but having had that type of environment that I've been in, it has made everything so much easier. The staff are very professional. I am very impressed with the hospital itself, the doctors, the facility. I can't fault it.
So this total arterial graft is a very good procedure for the young patients specifically, because these grafts will last almost for 25 to 30 years. And in patients in whom we cannot put the stents, this is one of the best surgeries which we can do. So this patient has returned back to Zambia full of happiness and gathered all the confidence which he has lost while doing the treatment previously. Thank you.